Hi all, so welcoming you all to a healthy episode of Healthy Lifestyle Commune. So many of the patients used to ask me, ma'am, is there anything to cut just belly fat? Okay, and you may be seeing many ads. Many ads means everywhere is filled with many ads, isn't it? In the YouTube, in the Facebook, or in any social media platform, what you will be seeing is that somebody who was not medical, okay, would be telling you can reduce 15 kg or up to 25 kg in 1 month. And what you will guys will be thinking, oh, let me take that powder. I cannot find time for gym. I cannot find time for yoga. I cannot find time for walking. Okay, friends, I am asking you one thing. Whom are you fooling? You are fooling yourself fully, isn't it? Some of them maybe got good result. They will be telling you, no ma'am, I have got good result with this powder, that powder and all. You will not be having any side effect now, dear. The side effects will be known only after many years. Then whom will you blame? And some of them have been telling that it is authentic Ayurvedic product. How it will become authentic Ayurvedic product? I don't know. Okay. So why I am telling these things and all, we know Rome is not built in a day. Same is happening in the case of obesity also. So we must be knowing how to reduce or how to control this. Yeah, weight increases in grams and only leaves in grams only. Yeah, it is very important to know. So, weight comes to our body in grams, leaves our body in grams. Okay. So, whenever you are thinking, that is, you are serious about to reduce your weight, what you must do? You must be following certain protocol. So, if you want to really lose this weight, please watch this full video. Okay. At the end of this videos, I will be demonstrating you 3 videos also about cute little exercises to reduce your belly fat. Okay, so let's enter. So how does we know when the body natures of body constitutes of 3 types actually. They are of Vata nature, Pitta nature and Kapha nature. Vata nature patients will be lean in structure, yeah, throughout their lifetime up to a college, then after the family life, after some certain years they will be gaining a belly fat. So Vata persons, how do you know Vata persons? They are lean in structure and most of them may be athletic frame bodies and all. Okay. So they all will always be telling to me, ma'am, I was comfortable when I was lean. Then let's come into Pitta nature. So Pitta nature, what is happening? That is, some persons will be having very easy to gain weight and lose weight. Usually they belong to Pitta category. About the Vata persons, sometimes in their lifetime they may have taken many lehyas and all to gain their weight and they may have not gained weight during that time. Okay. Then Kapha persons, yeah, the strong built heavy persons who will be chubby like persons. Whole of their lifetime they will be chubby like. So what's the problem? They will not be easily losing the fat. Yeah, so body constitutes of these 3 types. So you are gaining weight or losing weight will depend upon these 3 also. So I have given you an introduction how we treat in Ayurveda. So let's get into the physiology. Here what is happening? You will be taking a lot of food and this food, what is happening? It is reaching into the pancreas. Pancreas is actually secreting insulin. Then after that, what is doing? This energy is stored. It have to be stored somewhere, isn't it? It is stored in your body. First it is stored in your liver, then it is stored in your stomach. So this is what the fat is produced. Because whatever food we are taking, we are not utilizing that energy. That is what happening. So it is not a 1 day or 2 day process. Lifelong it is happening to our body. And what we are doing? We are filling our body with these energy and all. So first what we can do, let's bring some change in our lifestyle and let's cut some of the food mainly. Okay. So what change in the lifestyle you have to do? Early to bed, early to rise. Yeah dear, I am very serious about it. If you are a person of night shift, you know how difficult for you. That is, you will be taking food in your irregular timings and after that you have gained diabetes, BP problem. Then you will be coming to a doctor and telling, I want to reduce weight. It's not possible. Okay. So bring it an order. That is early to bed, early to rise. Take your food on time. Very, very important, dears. Take your food on time. Don't cut your breakfast. I have seen many of them. Why they are simply cutting their breakfast? If you are keeping on cutting your breakfast, dears, you are not going to lose your weight. Very important point. Okay. So you have to take your breakfast, lunch and dinner on time. Dinner always, if you want to lose weight, 3 or 4 hours before, you must be stopping your dinner. That is also very important. So what all food you have to avoid? Yeah dear, it is very important. You must be avoiding processed food. Okay, and you must not be too much dependent upon this fried items and all. Too much of fried items, too much of fast food, biryani items and all, because these will again is producing unnecessary fat in your body and they are not at all getting digested. And what you have to do? You have to do is that you have to cut hydrogenated vegetable oil on your body, trans fat from your body, vanaspati. Your sleep must be regularized, otherwise you cannot do anything. And maintain a good exercise also. As soon as you wake up, make sure you are doing exercise. If you are not doing enough exercise, very sure dears, you will not be going to lose your weight. Okay, there is not any magical remedy, that I am telling. Then what you have to do? What are the complications of this? So complications of the obesity are, we know, acidity, ulcer, fatty liver, most of us will be having, and we will be thinking fatty liver is common. No, fatty liver is the stepping stone to diabetes. It is also the stepping stone to blood pressure. So you have to be very careful about that. Then what you have to do? Then next, fatty liver, diabetes and all. Next, what complication? Yeah, most of you will be having back pain, isn't it? Yeah dears, after an extent, because most of the ladies will be experiencing during the pregnancy time, they have got a bad backache and that have not gone because some of them had undergone C-section also. Okay, so you have to at any cost reduce your weight, but don't be in a panic, reduce it systematically. So let's come into the food style. So morning, what you will be taking? Morning, make sure you are taking fiber rich food in your diet. Don't keep on taking this idli dosha items. They are not at all going to reduce your weight. Afternoon, what we can do? Let's take a clever choice. Yeah, we will be taking most of the vegetables and a little rice. Yeah, because we are in South India, Tamil and Malayali peoples, they cannot cut idli and dosha from their diet. Then night, what you will be taking? Night also, make sure easily digestible food only you are taking, and don't go with idli, dosha. Chapati also daily I am not recommending. Millets according to your body constitution. Okay, not daily, weekly thrice or weekly twice will be advisable for you. Okay, so like this, take. Then after this, I have advised you as many good exercises. Please do that also. And which is your choice? Some of them will be more familiar with yoga. Some of them will be liking Zumba. Okay. So if which exercise you are liking, yoga, Zumba, or along with that, any martial arts or anything like that, it will be helping to losing your weight here. But anything you do, please enjoy and do. Because I know many of the patients, some of them will be having motivation, they will be definitely losing the weight. Some others, 2 to 3 days they will be doing. 4th day they will be telling, oh, this is not possible for me. Nothing is impossible in this world, dears. So please try with your whole heart. Definitely you will lose your weight. Okay, thank you dears. Here we will be doing alternate movement of the legs like this. Then forward cycling and backward cycling. Do this for 10 times each. So here you have to hold both of your legs in the upward position, downward position. Like this you have to do 10 times. Both your legs upward, downward, holding, upward. Then you have to hold it in the upward position for some time. Then slowly place down, upward position, downward position, sidewise. Then you have to try to touch your heels. Yeah, this exercise also you have to do. Do each of these exercises 10 times a day. Yeah, okay. Give your whole body strength to both your hands and both your toes. Hold it for some time actually. As she is a child, she is not able to hold. Okay, but in your case you must hold it. Then slowly bring it down. Okay.